We've always heard, as lay people, but also as professionals, that oral hygiene, right, your mouth, can actually predict your risk for heart disease. And I never really understood what the mechanism was for that. The inability for your oral microbiome to produce nitric oxide just being hampered, that alone will cause endothelial dysfunction and, of course, heart disease, raising your risk for heart attack at a young age. So now let's take this to its obvious conclusion, and that is, what about using oral antiseptics? Right? Using Listerine and things that are advertised to reduce your bacteria by 99% in your mouth. All this time you thought it was a good idea, it may not be such a good idea, because reducing your bacteria so dramatically, especially before you go to bed, when you just had a meal that has nitrate in those meals, so green leafy vegetables have nitrates in there. Meat has precursor amino acids to nitric oxide. So there you are, you just had this meal, then you go to bed for the evening while you should be making nitric oxide or converting nitrates into nitrite in your mouth, and then you go ahead and brush your teeth, of course, which is fine, but then use an oral antiseptic. Now you've just shut down that mechanism, resulting in less nitric oxide during the night. So what we're saying is, yes, taking an oral antiseptic can not only raise your risk for high blood pressure, heart disease, heart attack, but also prediabetes, insulin resistance, and diabetes itself.